How's it going, guys? We have a medium difficulty question for Gastro. 7-year-old girl, she has a 3-day history of loose stools, flatulence, bloating after meals. Approximately 1 month ago, her 9-year-old brother, both her parents, and she all had mild watery diarrhea that lasted approximately 4 days after eating seafood from a fish market. They have all since recovered. The girl's stool pH is reduced. I'll talk about this as we move through the clip. It's a very easy, buzzy point, though, if you know it. A duodenal biopsy from a similar patient is shown, which I'll talk about as we move through. Which of the following is the most likely explanation of the patient's acute presentation, which means her 3-day history here? Choice A, ADP ribosylation of adenylate cyclase is wrong. Refers to 2 things in USMLE. E. coli, heat labile toxin, causing traveler's diarrhea, as well as cholera toxin. Now, traveler's diarrhea, they can say various countries, Middle East, Mexico. It's going to be a self-limiting watery diarrhea. Sometimes they can describe it as brown or green on NBME. Cholera is going to be profuse, high-volume, watery diarrhea, often described as rice water, flecks of mucus. And both toxins are going to ADP ribosylate adenylate cyclase within the small bowel, causing increased secretions. Wrong fucking answer. Choice B, ADP ribosylation of guanylyl cyclase. Wrong fucking answer. So this is 2 things in USMLE. It's going to be E. coli, heat stable toxin, which is just another cause of traveler's diarrhea, as well as Yersinia enterocolytica toxin, which will cause bloody diarrhea and pseudoappendicitis, right lower quadrant pain, classically in kids. It can cause arthritis in adults, sometimes reactive arthritis. Wrong fucking answer. Choice C, autoimmune to dietary protein, referring to celiac, is wrong. Our biopsy here is normal. In celiac, we'll have flattening of the intestinal villi. So you see these spaces between the villi here? You would not have these in celiac. It's just going to be flat. Okay? So blunting, flattening of the intestinal villi in celiac. And even though autoimmunity, wheat, oats, rye, barley, you're going to get iron deficiency anemia in USMLE. They really like that. So if you've done my YouTube clips, if we threw in the vignette, let's say, that she has a low MCV, low hemoglobin, very, very, very buzzy for celiac. All right? But it doesn't match this patient's history. But for the moment, I just want you to take home that you can get IDA with celiac. Obviously, there's things like IgA, transglutaminase antibody, anti-gliadin, which is the same thing as anti-gluten or anti-endomysial. Wrong fucking answer. Choice D, protozoal infection, refers to giardia, is wrong. Okay, so that's going to be almost always 9 out of 10 times steatorrhea, which is floating, foul-smelling stools. 1 out of 10 times they can say watery stools that are foul-smelling and float. So they'll use the adjective watery, but 9 out of 10 times it's steatorrhea. Floaty, foul-smelling means steatorrhea. Now, giardia, fresh water sources can be lakes. They could say scuba diving in Mexico on an NBME. You say, well, doesn't that mean salt water? Not necessarily. Maybe they went to freshwater in Mexico and they like showing you images of giardia. There's increased risk with IgA deficiency as well. And you treat with metronidazole. Wrong fucking answer. Choice C, transient lactose intolerance, aka secondary lactase deficiency, is correct. So this is what you gotta know for USMLE. First of all, you're gonna have a normal intestinal biopsy in lactose intolerance / lactase deficiency if it's performed, which we have here. Number 2, they can tell you things like reduced stool pH or hydrogen breath test is positive, some things that are mentioned. But the key thing I want you to know is that obviously lactose intolerance can be polygenic / hereditary, okay, especially in Asian populations, but it can also occur after viral infections. And in this case, it was probably norovirus. It doesn't really matter the exact virus. We know it's not rotavirus because she's not under the age of 5 and you wouldn't have the rest of the family getting it. And they don't say anything about immigrant status, unvaccinated. It's probably norovirus, Norwalk virus. And that can lead to sloughing of the tips of the intestinal villi, where you get sloughing of that brush border, and it can occur sometimes weeks to months after an initial gastroenteritis, which sounds weird. You say, well, if the gastroenteritis was a month ago, why wasn't the lactose intolerance sooner? Great question, but it can occur weeks to months later. So just know that if you get what sounds like a malabsorptive condition on USMLE following a gastroenteritis, classically in pediatrics, that's secondary lactose intolerance, and it will go away usually within weeks to a couple months. Correct answer.